So another part to RFK Jr.'s Make America Healthy Again, but Attack America's Doctors is to continuously talk about how doctors do not have nutritional training. And now he is actually getting medical schools, probably through some coercion, to add a 40-hour, so 1 week's worth of nutritional training to medical school. And this is getting touted as like this great thing. Thank goodness. Doctors will finally be able to address the chronic health epidemic in the United States because of 1 extra week of nutritional training. It doesn't make sense. Like, this is absolutely a scapegoat. It's pointless. There's no point to this. And we'll probably spend a ton of money on this, and he'll get to have a nice little photo op. And here's what doctors are actually needing. Doctors need education to be less expensive so that you can have more people actually go to medical school. We need for insurance companies to let us do our jobs. We need more time with our patients. And I would love to give nutritional advice to a family that can afford to buy the foods that I am recommending. So often, I know exactly how to educate a family on what are the best ways for them to access a healthy diet to treat and prevent conditions. But when I have patients in front of me that do not have access to these things and cannot do that, or are living in fight or flight because they don't have jobs, they don't have transportation, they don't have access to care, me knowing 40 extra hours of nutrition that I learned in medical school 25 years ago is not going to make a difference. If he really wanted to make a difference in preventing chronic health, he would stop fighting vaccinations. He would stop adding more chemicals to all of our foods. They would stop decreasing SNAP benefits. They would make everything easier to access, and that would improve our chronic health epidemic right there. So that's why a lot of us are really angry about this, not because we are opposed to any more education. I have a degree in nutrition. All I know about nutrition now, I had to learn within the last 5 to 7 years because it changes. And so any amount of education you want to give to anybody, we're all on board. But this is a scapegoat. It's a way to try to say that the chronic health epidemic is all about this extra week of nutrition training when it has nothing to do with it. So please don't fall for this. Demand from your representatives that they get this person out of there. We need a real Health and Human Services director. We need a real CDC and NIH, because what we have coming with diseases in the United States is no joke. People in Utah, Florida, South Carolina, Texas can all tell you what this is like. And we need real people who are real serious and understand what's going on to be running our public health.